drugs for angina pectoris or chest pain. Angina pectoris is chest pain because there's insufficient blood flow to the heart. Nitrates relieve angina by dilating and widening the veins and arteries, causing smooth muscle relaxation. You treat an acute anginal attack using rapid-acting ones like nitroglycerin, either sublingual, IV, or spray. You use sublingual nitroglycerin for acute angina. You're going to place one tablet under the tongue every 5 minutes for a max dose of 3 tablets. Patient teaching: if chest pain has not improved after 1 dose, call 911. Tell patient they will experience tingling, burning feeling under the tongue. Keep tablet away from light, heat, and moisture. If using spray, release the spray onto or under the tongue. Do not inhale the spray. Keep fresh bottle of sublingual nitro, but because drug only stay over 3 to 6 months. Sit/lie down and take meds to prevent orthostatic hypotension. Some nursing considerations include it's contraindicated in patient with head trauma and intracranial bleeding. Be careful when taking with other drugs because it can decrease blood pressure. Some adverse effects include for CNS, it's headaches, which is expected, syncope, flushed feeling, dizzy, weakness, CV, hypotension, reflex tachycardia. For the patch, you put on the hairless area on the upper arms or body and rotate sides. You decrease tolerance by removing it at night to allow 8 to 12 hours without the patch for your free period. Apply once a day, wear for 12 hours. Use gloves to prevent ointment on hands because it can cause vasodilation and decrease blood pressure. For ointment, squeeze the prescribed amount onto the paper and apply to skin without rubbing and tape the paper into place. You have to have night-free periods by removing at night for 8 to 12 hours to prevent drug intolerance. You should remove the patch at night after wearing for 12 hours and use gloves to prevent it getting on your hands. And then, because it can cause vasodilation and lower blood pressure. For nitrates, if you take it with PDE5, you'll experience head trauma, intracranial bleeding, and it causes life-threatening low BP. When you teach this with patients, avoid alcohol, slow discontinue med or rebound hypertension, sublingual nasal during acute angina, and have a at-home BP cuff. For rapid acting, you have sublingual, spray, and IV. And then for long acting, you have by mouth, which is extended release, and transdermal. Remember, for extended release, you do not crush these pills or open them and stuff. You evaluate the effectiveness of nitrates by seeing if it relieves the chest pain.